Netflix on the screen, healthcare in between, physics, art, and math got us down this path. Historical tales come alive, where science and stories dive, blended facts with heart, knowledge from the start. Me, Bricks, Blues, we sing to the future memory. Health and science in the mix, Me, Bricks got the fix. Complex subjects make
right
clear
now
every episode
in ways that we actually acquire
leads the way,
and ways that make me more efficient.
in the world of digital streams, turning knowledge into dreams. Through the tales of old, new stories unfold.
Thank you so much for joining with me. It is truly an honor and a privilege.
MedBix Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges.
Hey, welcome to the MedBix Webcast. This is Raman Raju. I'm the host. Thank you for joining. So we have a specialist, actually, a pediatric neurologist is a guest today. Then after, I'm going to talk about some mathematics and beauty and the autism and mental health, all those things we're going to talk about a little bit more. So, you hear the contrasting music. One is the Indian and the other one is the blues. Both I love it, So, I'm broadcasting from center of Silicon Valley, So I've been, this podcast started as I spend a lot of time in healthcare, but I'm a physicist. Mathematics and physics is my background. So I loved this concept of introducing the mathematics and physics to the medical community, because I spent 3 decades in healthcare providing diagnostic services. I did a CT scan, MRI, all those things. So this is the time I want to bring a different specialist and really things, that I wanted to bring a different walks of life, doctors to the podcast. I have a good friend. His name is Uli Chettipalli. He's an Innovator MD, CEO for InnovatorMD.com. He is a physician here in Silicon Valley. He talks about his wife and his daughter talks about quite a bit about the autism spectrum, brain expansion group they are in. Autism, that's what he says. I'm surprised about that. Autism is increasing in an exponential rate. I'm not sure that is a very alarming rate. It's increasing. We don't know the reasons, or probably we lost this specialist coming up. Her name is Sailaja Golla. She is from my back home, from my home state, close to home state. I used to, when I was a kid, I used to remember my father used to talk about Ballari. She's from a state of Karnataka, at the border of my state and the another state, neighboring state. But she is a very prolific researcher. She did a lot of she wrote a chapter in the book, and she won several prestigious awards, actually. And then neurodevelopmental research scholar she is. She published some peer-reviewed papers on the mom-approved doctor. I learned from the first time it's a moms all together approve the doctors. I think that's a great idea. So she's a mom-approved doctor. So let me bring her to the main stage, and then let her introduce herself a little bit more. Welcome, Sailaja Golla, Dr. Golla. Thank you for joining.
Thank you, Mr. Ramana, for having me here. It's a privilege to be here, and thanks for hosting me.
So tell us a little bit of your personal background, where you started all these things, your medical school to up to this point. Just briefly, we can run down the.
Absolutely. I am a pediatric neurologist with additional subspecialization in neurodevelopmental disorders such as autism. My medical schooling goes back all the way to Bellary, where I did my medical college in India. So I am a foreign medical graduate, and then I did my residency at SUNY Buffalo and my fellowship in pediatric neurology at UT Southwestern Medical Center in Dallas. And I did another fellowship after that, not to stop, because my passion always was the concept of mind, but also autism and neurodevelopmental disorders. I believe if something can be done, it should be done at a very young age because the brain has the synaptic plasticity and it could be molded in a very young child. So early diagnosis and intervention is the goal. That's a little bit about me, and I currently work at Children's Hospital of Orange County, UC Irvine, at the Thompson Autism and Neurodevelopmental Center. I've been here in California for 4 years, and it's been great so far.
Yeah, let me bring you a little bit. I'm going to come and join with you. Um, Let me ask you a question. You know, just you mentioned just now. So you have a neurodevelopmental research. You're a doctor, and then before I introduce you, I said that the autism is growing in this country alarming rates. Is that true, or what is the cause you think?
It is growing. Currently, as per the CDC, the Center for Disease Control, the prevalence is 1 in 31 children, which is quite alarming. Just 5 years back, it was 1 in 100, and 10 years back, it was 1 in 150, 160. I think it's a combination of both increased prevalence, truly, but also it's increased awareness. There's increased diagnosis rate. In the past, it was just diagnosed as mental retardation or cerebral palsy, and they were all put in this group of special education. But now I think we have advanced diagnostic techniques, and parents, caregivers, physicians, everyone is more aware of how autism is different from other neurodevelopmental disorders in general.
Let us talk about the differences. Is it that these are all genetic disorders, or is it a behavioral, social? What kind of disorders these are all? Are they? We know the first of all we know the reasons why it's increasing. So detection is one of them. You said, but is there any other reasons we find the reasons all for the increasing this dramatic increase in this autism?
So there is a combination of genetics and environmental factors. And of course, 70 to 80%, we still do not have a cause on why a subject could be diagnosed with autism. The genetic causes could be like chromosomal abnormalities, FragileX syndrome, Down syndrome. There are several other syndromes, genetic abnormalities. There is environmental factors, like if there was a prenatal, when mom is pregnant, if she was exposed to alcohol, for example, if she was a drug abuser, if she was on drugs throughout her pregnancy, smoking in pregnancy, prematurity, some kind of birth defect. All these are other environmental causes for autism, and sometimes the environmental causes can be predisposed in a genetic child. Like, for example, if there is a genetic mutation, but if the child is also premature, that puts him or her at higher risk for autism. So that's epigenetics, like a combination of
Yeah.
genetics and environmental reasons.
Oh, it's interesting. So it's a one of the things is that you say that there is a kind of studies are done on the alcoholism and the smoking related to the autism for the woman, particularly during the pregnancy. That's what you're saying, right?
That's right. Yes, there are like fetal alcohol syndrome. Those children are highly predisposed to neurodevelopmental disorders such as autism, where the mom has abused a lot of alcohol or any kind of drugs, for example, cocaine, marijuana, and now I think it's more freely available. So that also indicates an increased why is autism increasing? Also, younger mothers getting pregnant or old age, like 35 plus, they're at high risk as well. So if there's a very young mom, or if it's 35 plus, they're again at risk for autism as well.
Dr. Gola, you're a specialist in a fragile X syndrome, some genetic disorders. Tell us a little bit about that. What is the relationship with the autism and the genetic disorders like Rett syndrome and fragile X syndrome? Just can you give us a little bit of a briefly the differences between them, or what are the relationship between them?
Absolutely. So like I mentioned, 20 to 30% of the time there is a genetic cause for autism. So Fragile X, Down syndrome, Rett syndrome is one of the genetic causes for autism. There can be a Fragile X child or a Down syndrome child who does not have autism at all. So for example, with Fragile X, 30 to 40% of them have autism. Rett syndrome, 50% or more. Down syndrome, it's 30 to 40%. So it's variable. But if they do have a genetic syndrome, they're at higher risk for autism, is what I would say. And it's very important for every child with suspected autism to get a genetic testing. And right now it's universally available. It's covered by most insurance companies. Though these tests are quite expensive, it's covered. So as caretakers and parents, I think it's good to ask your pediatrician or your family physician to make sure the genetic testing is done. And if it's an adult, I think they can ask their internist as well, because 20 years back, we didn't have the concept of genetic testing, because genetic testing helps you not just with a diagnosis, but also there might be new treatments. For example, for Fragile X syndrome or Rett syndrome, there might be newer treatments or advanced treatments. Also genetic counseling, if the mom wants to get pregnant again, for example, then there is a higher risk if there is a genetic cause, or testing siblings. And sometimes we also test parents as well if they're carriers or have subtle signs and symptoms.
Let me ask you about this fragile X syndrome and all those things. What is it? Symptoms? Can you declassify between the autism and then fragile X syndrome, Rett syndrome? Are there any differences between all these genetic disorders? They all exhibit same kind of characteristics.
There are subtle differences, and for example, Rett syndrome, it's very common in girls, while Fragile X is more common in boys. With Rett syndrome, they have seizures, not as common with Fragile X, for example. And with Rett syndrome, they have this hand wringing movements, which is like the classic for Rett syndrome. It looks like autism. They have poor eye contact. They have significant behavioral challenges, but also they have speech regression and these odd hand wringing movements. And that makes the physician, okay, we need to check this girl or this child for Rett syndrome, which is caused by a specific mutation called as MECP2 mutation. Similarly, for Fragile X, they have long face, they have prominent ears. It's transmitted through moms. So maybe the mom of the boy probably has some mild learning difficulties as a child. So that's something which we can dig out by a detailed family history, birth history, and so on.
You said that earlier detection is the key. You're saying that important. Tell us why it is so important for the earlier detection. What are the things that can make it better?
So I always say time lost is time gone. The sooner the child is diagnosed, they will have access to therapies. Right now, we all know that there is no cure for autism, but there are a lot of interventions which could decrease these signs and symptoms of autism or make it better. For example, if a 12-year-old starts therapy at 12 and is diagnosed at the age of 12, already the time is gone. So starting speech therapy at 12 years old is different from starting speech therapy at, say, 2 or 3 years of age. And to start those
You
therapies—
mean to say, sorry to interrupt you, but you're saying if they do it from 12, the outcomes are going to be different than if you start at 3?
Exactly. Better outcomes are when a child is started at a very young age. Typically, they're diagnosed between 18 months to 3 years of age. So once they get a diagnosis, there is something called as applied behavior analysis therapy for children with autism. And that's a behavior therapy which improves social skills, restricted repetitive interests, speech, and so on, communication skills. And in addition, speech therapy, occupational therapy, physical therapy as needed are also recommended. So these, if started very early, might make a difference and help the child who is diagnosed with autism. So early diagnosis in term leading to early intervention and treatment.
The tools you have at this time to detect these kind of diseases or genetic testing, and is there any other behavioral testing you do that? Are there any other testings available? Um, One more thing I wanted to ask you about that is AI kind of now. We'll talk about that a little bit later on. But are there any other tools, traditional tools available right now to test this autism spectrum?
Yes, absolutely. So at first, the child or the parent takes the child to the pediatrician. There is something called as MChat, just like the chat window, CHAT, and it's free of cost. It's online. Any parent can fill it up. It's available for pediatricians, and now it's recommended that all pediatricians do that screener. It just takes 3 minutes. It tells you if the child is at risk for autism, has red flags for autism or not, and if he or she tests positive on that MChat, I think it's very important to refer the child to a psychologist, a neurologist, a developmental pediatrician, or whoever is a specialist in autism, so they could get a confirmed diagnosis. A confirmed diagnosis is additional detailed testing such as behavioral psychocognitive testing and so on. In addition, if you suspect any a stroke or anything abnormal, we also recommend an MRI. It's not mandatory MRI brain. If there is seizures, we recommend EEG. And like I mentioned earlier, genetic testing is very important. We also make sure that there's no hearing loss, do a hearing screen, a vision screen, and basic additional blood work as well.
Sailaja, is it the obvious one? Is the eye contact, eye to eye contact, right? If that misleading about that, that is one of the important factors there, or just is one of them?
There's two big things which are in the DSM-5 criteria for autism. One is the social skills. So within social skills, eye contact is one of them. And that's the big one because we see it quite prominently. They have difficulty communicating. They play side by side, parallel play rather than interactive play. So that is the social skills component. And then there's number two, which is the restricted repetitive behaviors, where you see flapping of the hands or spinning in circles or lining up of things or playing the same video game again and again, repeating the same words. So that's number two criteria. So basically we test them on these two criteria, the social communication domain and the restricted repetitive interest domain, which are the hallmarks of autism.
So, you gave me some tools for the detection. Let us talk about the treatment a little bit more in detail. Most of them are psychological. Is there any advanced tools available like a gene therapy or genetic counseling and all those things under the soft skills, soft kind of a therapies, right? So, is there any hardcore therapies like a CRISPR? Can they use it is there any available right now for the autism patients?
That's a great question, Mr. Ramana, and thanks for bringing it up. So there are new advances day to day as we speak. Autism is a multi-genetic disorder. Of course, there are some single genes like MECP2 causing Rett syndrome, but typically there's multiple genes involved with autism, and that's the challenge in using gene therapy. However, that being said, there is CRISPR gene editing being developed in the mouse model, and hopefully it's been developed in other known syndromes for autism, such as FragileX syndrome and other neurological disorders, hoping that there will be more studies in humans like phase 3 clinical trials, and gene therapy is advancing day to day, whether it be gene editing using the CRISPR model or gene therapy using the adenovirus model. It's like the future. And I think we have found great impact of gene therapy on certain neurodevelopmental disorders and neurological disorders which did not have a treatment and high mortality. So looking forward, but as of today, there is no gene therapy clinically approved for autism. It's still in the experimental phases.
Brain is a complex mechanism. My wife and my children used to tell me I have this ADHD.
All of us have ADHD, right?
Yeah. So So there's one of the things is my son said that I got it from you, Dad. He told me that. Uh, what do you think of this ADHD relationship with this autism? Is there any relationship there? Creativity, curiosity, all these things is a kind of a part of the autism spectrum, I think.
Yes, so autism is a spectrum. It's like an umbrella where every child with autism is different from another child. There are common features and social skills and restricted repetitive interest, but again, it's a spectrum. So there are a lot of comorbid psychiatric conditions and comorbid medical conditions with autism. So in a child with autism, there is a 70 to 80% chance that they can also have features of ADHD, which is like hyperactivity, inattention, impulsivity, trouble focusing. It's not simple ADHD, it's more of a complicated ADHD secondary to autism. Similarly, subjects with autism can have anxiety, obsessive compulsive disorders, oppositional defiant, aggression, and other disruptive behaviors, sleep difficulties. Medical problems such as seizures are quite co-occurring in gastrointestinal problem such as constipation, weight loss and weight gain are quite common with autism as well. So it unfortunately comes in with a package, but I think if it's addressed at the right time with the appropriate specialist, there is definitely a positive hope.
You see, some section of people that autism is like a savant. They can tell us 20 years ago, November 13th, what is the date? What is the day? So these people have these special skill sets. And then I had a cousin actually. We had this. He was autism spectrum. Now I realize it, and now at that time I didn't know. He was a great singer. He's a beautiful. You see, he can imitate any singer, that he gave a natural talent for him. What do you think of these special talents? And we know the reasons, or we know the underlying mechanisms of this process.
Yeah, so I think we are talking about high functioning autism,
Yes.
where they have extraordinary skills. Again, all children with autism do have extraordinary abilities, like they're really good with memory. Some of them are good at mathematics, and there are children who are good like at directions. For example, if the mom drives in a different direction, they redirect. No, this is different. So I think in the past we had something called as Asperger's disorder, which was part of the autism spectrum. Now it's taken out of the autism spectrum by itself. It's a separate disorder because Asperger's, they usually do not have speech difficulties. But with high functioning autism, I think they can function normally. They just have the social skills domain as a difficulty. And then adults, I have seen them being like radiologists, for example. You don't need people skills to be a radiologist. You can sit behind the screen and read the x-rays. They can be neurosurgeons. If they have high functioning autism, I think they can do really good at certain jobs which do not require social skills. So that's something similar to like savant syndrome, or like savant features, where they have extraordinary capabilities more than even the general population.
One of the famous guy is Elon Musk. He says that he has
There you
yeah,
go.
a controversial
Yeah.
guy, but yeah. So this autism spectrum is such a we are recognizing more and more. Some people, critics, say that we are pushing too much autism into the normal behavior itself. We are classifying as autism, and there is some social context. They say, is that true, or is that criticism is not justifiable?
I think it's a mixture. I would agree with both. But again, there are some misconceptions of autism. Like I would say, vaccines do not cause autism. That's a big
Yeah.
misconception for everyone to be aware of. And it's proven, but we get those questions often. Like just today in my clinic, one of the parents was asking me, "Is there any new research that vaccines can cause autism?" I was telling no. It's unfortunately it's around the same time. So.
I'm glad you just mentioned there was a testimony in the Congress today, and that the Secretary of Health was saying there's no safety protocols for safety studies are not done on these vaccines. That is alarming for a lot of people. maybe misleading that a little bit. I don't know the. So we need to really understand. He's saying that most of the 76 vaccines do not have safety net. They go through a lot of safety studies. They go through a lot of FDA approvals and all the licensing. So you as a neurodevelopmental child neurodevelopmental specialist, you would ringingly and you endorse vaccines, no, without any problem, right?
Absolutely, absolutely. So we recently had the MMR, the measles outbreak, sometime back in Disney. Like that's a good example. Like the one of the child was not vaccinated and it just spread. So I think it's very important, at least here in US. I think it's very important for a child to get vaccines, even to be admitted at school, for example. So we don't create an epidemic or a pandemic.
Yeah, I am going to, well, let us talk about a little bit. I'm going to be, on the side, yeah, yeah, let me bring you aside. Actually, Dr. Gola, I'm going to present a little bit topic about this. This my podcast is a very specialized kind of podcast. I've been doing 2 years. What I do is in the middle something. The innovation is important now. Silicon Valley. I'm in the middle of the Silicon Valley. We'll talk about when I get back. I will ask you about artificial intelligence a little bit. What is the AI can do in the future for the autism? Are there any new diagnostics tools available through AI? I will ask you. So, and then your contact information if you wanted to provide something. So let me bring something that I'm going to talk about that a little bit. And then I'm going to talk about this extraordinary woman of the past years. So then you can jump in anytime. There is a little bit about autism about there. The CERN is the biggest accelerator, the largest accelerator of the particle accelerator in Sweden and Switzerland and France. Is a 22-mile radius, biggest one. In front of that is what they're looking for is supersymmetry, a supersymmetry of particles, that electrons, protons, electrons is called fermions and bosons. I don't want to go into too much into the doctors. Yeah, doctors are watching, but the classification of these particles, they wanted to find a supersymmetry, a twin particle. That is called supersymmetry. They're looking for that through. This is a hadron collider, is a huge collider, $10 billion worth of, that's expensive equipment actually. So what they do is they move around the accelerator, the protons, and hit it, and then recreate the conditions of the beginning of the universe, basically, and find out what's going on. So the reason I'm talking about symmetry is important. I wanted to talk about that. It comes in this autism a little bit. Dancing Shiva, they put in front of the CERN, they put a dancing Shiva statue. The reason is dancing Shiva statue is a radial symmetrical thing. It has a lot of symmetry inside. I tell you what the symmetry is. So they instituted this right in front of the CERN Hadron Collider in Sweden, Switzerland. So let me talk about this a little bit of a. This is a radial symmetry. This is a symmetry called that. Yeah, the nature, you find a lot of symmetry in the beauty, but you don't call symmetrical. But you see the nature is beautiful flowers, and then your diamond is a perfect symmetry. Actually, is one of the definitions of the most expensive symmetry you can see. But there is another one. I'm going to talk about the doctors learn about Leonardo da Vinci diagram about how the human body is a bilateral. Is that the quality of being made up of exactly similar parts facing each other or around an axis. That is a symmetry definition, kind of a definition symmetry. Heart is a bilateral symmetry, and the lungs are also bilateral symmetry. This is a very important aspect. But so you will find a symmetry in everywhere, in biological, medical. I'm going to explain to you in structural, functional. All of them is very important in the symmetry, the role of symmetry in the regular life. These are three beautiful people: Marilyn Monroe of Hollywood, and then there's Denzel Washington of Hollywood, and Aishwarya Roy. These are the most beautiful women. The People magazine say they're the most beautiful people. Whatever it is that, the beauty was defined is if you take an axis and draw in between the eyebrows, and the left side is more similar to the right side, that is called a good symmetry and beauty. Definition of beauty, they said. I'm not sure I don't agree with that, all of them, but that is one of them at least. So there is also a lot of honeybees, for example, sex and everything, that women attracted to the more of a bilateral, the facial symmetries. And then honeybees, what they found out is honeybees really attract to the beautiful flowers, not just honey itself. They go to the beautiful flower, they get attracted to. So beauty, so there is, but then we humans have a fear of asymmetry. If you see our faces like a Joker or Frankenstein, we get scared because that left side and the right side, if you draw an axis, left side and right side are not matching. So evolutionary fear comes out of the process in the symmetry. So, this is a OCD. I have a friend in Philadelphia. She is a OCD. I go to her, it's like a hell almost breaks loose. I put something in the refrigerator in the side, and she got an obsessive compulsory disorder. So what they're saying is, now the psychologists are saying, the most geneticists saying, it is not a psychological disorder. It is not a psychological disorder. It is maybe evolutionary genetic disorder, fear of asymmetry, a genetic problem. That's what they're thinking. This is a very interesting conclusion. We can ask Sailaja about that when we get back. OCD could be genetic disorder. So just now I was talking with Dr. Golla about the autism spectrum patients. They have heightened visual perception. They see more patterns than other people. One of the things is quantum computers do parallel processing. They're parallel processing. What they're saying is autism people may be doing the parallel processing versus hierarchical integration of our system that normal people do. So they may, exceptional abilities of the people like savant, they may do parallel processing. That's one of the researchers saying that. But I tell you, I'm going to shift the gaze to a little bit about symmetry. Why symmetry is that fundamentally makes sense. The Einstein got a problem. Einstein got a problem means that's a bigger problem. Law of conservation of energy, when in expanding universe, law of conservation of energy is not holding good. Law of conservation of energy is that energy is neither conserved nor destroyed. It always remains constant. But in this case, in expanding universe, the law of conservation of energy is not conserved. That bothered Einstein. So who came to rescue? Woman came to rescue, for Einstein. Her name is Emmy Noether. She's from Germany, Bavaria, in 1888. She was born in 1888. She's a mathematician. She's a mathematics professor in Bavaria, Germany, a province of Bavaria in Germany. She was a Jewish woman. She shed a light on the profound understanding of symmetry. What is a symmetry, what that role of symmetry is. So what she says is that, so she was actually a mathematician. So she was the first professor, second one get a PhD in mathematics, and the first professor in the world actually is in Germany at least. So she was saying that beauty is a more fundamental. Laws of symmetry are more fundamental than the laws of physics. Laws of physics are emergent property of the laws of symmetry. So it's a little confusing, but I'm going to explain to you a little bit more. It is even I'm going to bring a video to explain a little bit fast. That is it gives you 1-minute video I'm going to show you.
Look into a mirror, wave your hand, and your reflection will wave back at you. In everyday life, it's easy to take the effect of symmetry for granted. But symmetry is vital to understanding and predicting how our universe works. This relationship between symmetry and the mechanics of the universe was something Emmy Noether proved in 1915 with her remarkable theorem, linking maths and physics in one harmonious statement. Wherever there is a symmetry of nature, there's a corresponding conservation law. So what exactly do we mean by symmetry in physics? Well, it can be described as a transformation that leaves a system fundamentally unchanged after the transformation has been performed. It's a change that makes no change. Take, for example, spatial translation. If we have a system and move it to a different point in space, that system would continue to work in the same way, provided all of the relevant conditions of that system were moved along with it. In other words, the laws of physics are not affected by translation in space. And similarly, with time translation, a system can be shifted at any point in time, and its physics would remain unchanged too. Even the most fundamental laws of physics are themselves symmetrical. They remain the same wherever or whenever you are in the universe. The symmetry of time translation confirms to us that energy cannot be created or destroyed.
That is let me take it out, this one. Just a minute. Yeah. So let me bring that. What happened to the? Oh God. Yeah. So that is a symmetry of the, basically what it's saying is rotational symmetry. For example, if you see a snowflake, you move around any other direction, any other degree around about it, it looks same. It is no difference for you. That actually translates into the physics, conservation of momentum, angular momentum. The bigger scatterers, they close the hands. The reason they do that is to preserve the angular momentum conservation. They have to close that to spatial thing. They have to do that. That is actually the rotational symmetry transfers into angular momentum conservation. Same thing is time symmetry. If you boil a water today or tomorrow, it's not going to change any difference. That's actually conservation of energy translates into. Very strange, but that is what those fundamental laws are. Geometry and beauty. Others said that there's a beauty in geometry. Geometry has a lot of beauty inside, and then so that's what she says. So so they are now using the structural symmetry in the detection of the breast cancer, for example. In the reconstruction of the breast cancer, or the reconstruction or orthopedic surgery and prosthetics, they're using symmetry algorithms. There's lots of them, symmetry algorithm in healthcare. So functional symmetry, for example, all the football players, for example, they ask them to go for what do you call that? Belly dancing, and not belly dancing, some kind of a dance, some dancing they need to learn. The reason is they wanted to see the movements, the symmetrical movements, to prevent injuries for the players. Protein folding, for example, in the discovery of protein, the molecular integrity, they want to see protein folds the way it folds. It remains the drug discovery is very important how the symmetry works. Those symmetry algorithms play very important role in this one. So psilocybin, for example, I'm going to ask you when I get back, Dr. Golla, about the virtual reality, what they role. One of the things they say when people take these mushrooms, that one of the things is their visual perception changes. That it is actually fractal symmetry. So we are happy to see the fractal symmetries. The brain is evolved into seeing the symmetries, the fractal symmetry, the things that visual graphics that come out of the psilocybin is a very interesting. So the next one is now what they're doing in nanocrystals, they do symmetry, the crystals, they follow symmetry algorithms to create a nanocrystals to deliver drugs. The symmetry is extremely important to delivering drugs, targeted delivery drugs, because ibuprofen, for example, avoiding a digestive tract is we counter the over-the-counter drug, but everybody uses it. But its big problem is a bleeding. A lot of people cannot take the ibuprofen. So what you need to do is you have a new mechanism that they can do is called a metal organic framework. That is, organic materials, inorganic materials, they combine them together. It's amazing. That's a new science. So they put that. They eventually they want to do the cancer drugs to the location itself, and then eventually they, I hope they do for the brain also. So she was one of the, she's a remarkable woman, and she moved to Philadelphia eventually. Emmy Nather moved this. She gave all the mathematical framework for the Emmy Nather's theorem. It's a framework for this entire. She died. You know, 18. She died in 1935. She moved to just last 2 years of her life from Germany to Pennsylvania, Philadelphia, and she died with ovarian cancer. So their ashes were spread across under the ground. Of a remarkable woman, and the Einstein called her the most significant creative mathematical genius. Einstein calling her genius is an important factor. That is really tribute to a woman. She was under recognized, under noticed. So I want to bring one of the historic woman from history, remarkable contributions to the mathematics, physics, and healthcare today. So I want to bring that to the table, and I will bring Dr. Golla back. But thank you for joining. Just let me bring her to this. Let me take it out. This, and yeah, 1 second. I'm going to move this. Okay. Thank you, Dr. Golla. Just I gave you some brief symmetry about that. That's where I don't know whether you know about. It's a, I'm in the center of Silicon Valley. All the doctors, medical people are talking about AI, mathematics, physics, chemistry. All of them now mix it together. Innovation side. What is what do you think of AI's role in the future of autism? One of the examples I gave you, autism, virtual reality, and brain training program. Tell us a little bit about that. What is AI? What is the brain training programs and virtual reality? What are those things, technologies playing a role in the autism spectrum?
Yeah, definitely. I think AI looks like it's the future, and I think there's a lot of positives too. I would say. I think AI is something which is available 24/7 compared to like using research assistant or whoever. Like AI is non-judgmental in general, so it doesn't judge you whether you're right or wrong. It just fixes the things. The role of AI in autism and the medical world, I think one thing I want to point it out is, again, it does not replace real people. It does not replace the doctor. So as much as AI is helping or assisting, it's not a substitute to seeing a physician or doctor, not just for autism, for any other reason. The role of AI in autism, particularly, it's helping us with early diagnosis now. I was involved in a research study a few years back. It's called as a Canvas software, where it's a software which is used for diagnosis of autism. It doesn't substitute the real psychology testing, but the pediatrician can just download the app, write a prescription for the app, and so they get the app downloaded, and the parent records a couple of videos at home, and then there's a remote AI assistant which analyzes those videos, and at the end of the day, it says if the child has autism or not, and the positive predictive value and sensitivity was very high, and now it is highly
This is
recommended.
what age? What age is any age? That I was talking with you about the cry diagnostics. Their new thing is coming up by listening to the talk, listening to the cries of the baby, infant baby. They can detect all these diseases. Is it really possible? That is, how far is that true, or how far is that we are in the research side?
That's a little extreme. It does help, but always human has to counter check. For example, if you just type in something, it can completely pull out a different disorder, which sounds like that, or maybe there's a little typo. Just let me give you the example of FragileX. So there is FragileX, which happens in children, and it's diagnosed as young adults, but there is a FragileX ataxia tremor syndrome affects TAS. So if you're looking for FragileX and if you put in a T there, it pulls out a completely different different syndrome, which is common in 60 plus years, for example. So it always needs to be checked and counter checked by a physician, but it does help modulate and helps with early diagnosis. So the Canvas software I was talking about, it at least helps the pediatrician diagnose a child with autism and get them into those therapies, which can be covered by insurance while they're waiting to be seen by a psychologist. The same way, like treatment wise, now we have virtual therapies, remote therapies, robotic based therapies, communication therapies. AI is also using assisting with speech therapy as well. So those play a huge role when the child cannot get into seeing a physical person or getting a physical therapist to work one-on-one. So it plays a huge role both in diagnosis, therapies, and treatment too. So I think it's really promising, and hopefully we will develop more advances with medical AI, and in particular in the field of autism and neurodevelopmental disabilities as well.
I have a friend, she is Jennifer, and her sister is a TBI, traumatic brain injury patient. She asked me, ask you this question. So her sister was placed in several nursing homes, skilled nursing homes, different places. And the problem she is having is that what she's saying is that they are putting too much drugging these people, and then like they act like zombies. Is there any solutions for this problem? Because otherwise she's screaming and all those things is disrupting the process. So how do you create that balance? Is there any solution for this problem at all?
Yeah, an excellent question. Again, I think I always use medications as the last resort. So I advise therapies first. Again, it's risks versus benefits is what I say. Of course, no parent wants their child to be drugged and sleepy all day. But if those behaviors are so challenging, like you cannot get a child to focus with therapies or focus and maybe complete a task, maybe finishing the food or participating in therapies or writing a page, then you need something to focus. There comes the role of, say, a small dose of an ADHD medication or something to help with the behavior, like an antipsychotic or an SSRI or an anxiety medication to lower the anxiety so they can perform better or they can do better. So always we need to outweigh the risk versus benefits. And I always suggest, please consult a doctor. Don't go in and just try to take over-the-counter medications or order it on Amazon, like you can get anything from outside. So it should be done under the supervision of a medical doctor or a physician. And again, if needed, it is helpful, but you always have to outweigh the risk versus benefits.
These are all God created diseases. We don't know what is the reason, or what God or whatever the reasons are. It is genetic disorders, it's autism spectrum. But there is another disorders we are creating, a man-made one, particularly man-made one, is these video games. The kids are playing video games non-stop. They have jittery feelings, and then they're diagnosed as ADHD, and they start giving this Adderall and all these medications. What is your opinion on this new problem that the country is facing and the world is facing, in fact?
I think video games and cell phones and computers, that's been like the babies are born with the and they operate the cell phone much better. A 7-year-old can operate it better than a 35-year-old or a 40-year-old because they know the system. So video games, I typically, as a physician or as a pediatrician, we advise them not more than 30 minutes and do like a positive reinforcement. Okay, I'll let you play the video game. Are you going to finish your homework? I know it's easy to say, but in practical life, it's really hard. So for ADHD specifically, interestingly, a company came up with a video game-based therapy. So a child has to play a video game for 10 minutes every day for at least 3 days a week. And that improves the focus, and it was effective a little bit. So again, that's a new invention with AI, that we have video games as a treatment for children with ADHD. That's just one of them. I'm not highly recommending that. But I think maybe giving positive reinforcement, like, yes, I think video game, let's play it together, make it interactive with the family or with the parent. So it's more interactive than one-sided, and limit the number of hours. So it might help them with focus with other activities as well.
The last question I'm going to ask you. I have a grown-up children. My children are grown, but they finished college and everything. But during the college times, I heard quite a bit. These people are using Adderall and all these focused drugs. It is becoming a very common in these universities. Is there any negative effects on this because by using of those kind of things? What is your opinion on this? The developmental side, or what is these kids doing? We call them kids, but still young man. But still, is there any effects on this? You have any, all the research scholars, neurologists? What do you have any common ground on these kind of things?
Yes, if there is a confirmed diagnosis of ADHD or a specific neurodevelopmental disability, I would highly recommend. For example, especially in the older kids where they need to take these complicated exams which need focus. So they do give them like a separate room, headphones and all that, but still they cannot focus. And if they have a formal diagnosis of ADHD, putting them on a medication such as Adderall or any other medication, even for a short time, is more beneficial than suffering with ADHD and struggling and failing. But this is only for confirmed. Again, there's a question about drug abuse, like a lot of teenagers and young adults just get drugs from wherever without a doctor's prescription. So that's not recommended. That's drug abuse. But using the medications as recommended is definitely helpful.
Hold on, Dr. Golla, that you quickly passed that statement kind of concerned me. You said that complicated exams. You're saying that the educational system is causing this. Education system is causing this kind of problem. That is a policy level problem. We have to address that. All the neurologists, pediatric neurologists need to address in the overall as a community. Hey, this is we don't want to press that, create this educational system so pressure, and they need to go for the Adderall and all these drugs. Do you have a comment on that, or you don't want to talk about that?
No, definitely. Yes, I would like to comment on that. So I think the education system is competitive and challenging, and hence we need accommodations, and not all of them have. I'm just talking of those few who actually have ADHD. They work, no matter, there's two kids, X and Y, and the X has ADHD and he's struggling like twice the number of amount as student Y. But student Y just studies before the exam because he's fine and he can take the exam. But X is like working so hard, but he's not able to focus. So X might need a small dose of a stimulant or a medication prescribed by a physician just to make sure his appropriate talent is shown to the world, and he's just not struggling with ADHD. And as kids, we remember like we didn't have all the diagnosis way back there, and we just had to struggle and get through and work much harder. But now I think we do have that. And again, medication is a last resort. It's only if needed to fare well academically or have significant disruptive behaviors.
Dr. Golla, you and me are from India. We have these new practices of yoga and meditation. Do you think that they play a role in you can reduce this kind of autism behaviors and correct some of the behaviors? Are there any studies done, or do you have any opinion on that?
Absolutely, and that's where the role of therapies, cognitive behavior training, yoga, meditation, martial arts also helps with ADHD. Things like music helps. Music therapies, we even write prescriptions for music therapy, dog therapy, equine therapy, horse therapy. Some of those are non-medication based, and a lot of them are non-medication based. and they do help. And of course, the environment in the home, how the family deals. So parent therapies are also essential. For example, yoga and meditation. If the mom sits with the child and teaches the child, it's more effective than just saying, okay, do yoga or meditate and it'll make your ADHD better.
I am very integrated. Last question, as I actually am adding more. My son is a neuroscientist. He studied in Vanderbilt. Now he's also a musician. He produces a lot of rap music and all those things. He produces albums. He says that there is a lot of connection between the neuroscience and the music. Tell us a little bit, if you can comment on that. Just you mentioned just now about that. I'm very integrated by that, and then we can close after that.
Absolutely. I think we have the center in the brain, the music center, and some children love music. That center is very well developed. And they say that in autistic children, they have a tendency, some of them, not all, are music oriented. Like you were just mentioning, Mr. Ramana, one of your friends' child just sings songs. I have a few of my patients as well. They love to sing, so their music
is my son actually is my son
is highly developed. Yeah. So I think that's a great talent. A lot of us have different centers in the brain which are a little better developed, but music therapy, no matter who it is or what age you are or what kind of disability or even neurotypical normal people, it's highly recommended. Depends on what kind of music you like, of course, but
yeah, what that's what he's saying is binaural beats and all those things. He's talking about the music influence on the neuroscience. He's doing a lot of background research. Dr. Golla, it's a pleasure talking with you. It is an absolute honor to talk with you. It's a very educational, informative, and a lot of people love this. Thank you so much for joining with us today.
Thank you so much, and thanks again for hosting. It was a pleasure as well.
Good night, all of you. Bye-bye.
We are retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give